Hi, everybody. This is Cindy Kennedy, and today we're going to be talking to Dr. Darin Ingels. He's very well known, highly respected, over 30 years of experience as a naturopath in the field of health. He's publicized or published. He is publicized. People know him, but he is well published and he is a speaker. He's super knowledgeable, and he has left the Northeast and now is in California. We miss him very much around here, but we're going to talk a lot about how the thyroid is impacted with Lyme disease. So I want to welcome you to the show. Dr. Darin, how are you doing today?
Oh, I'm good, Cindy. Thank you so much. How about yourself?
Hanging in there.
I heard you had to shovel snow earlier.
Yep, a little bit of snow, It was really funny because maybe a couple of weeks ago, it was nothing. Green, it was warm, and then this gigantic snowfall. We had 25 inches.
Oh my gosh.
Yep, and then shortly after that, it warmed up again, and it was gone. I was like, oh God, where did it all go? But yeah, that's what happens. You know, I'm sure you're enjoying your Californian time out there.
Well,
Go ahead.
I become officially a California wimp now, where, you know, when it gets below 60 degrees, we break out the heavy jacket and turn on the heat.
Well, you know, that's okay. I understand that if you experience cold for periods of time, you actually increase your mitochondria.
Yeah, that's
so
true.
There you go.
That's
you
true.
Can get a little shiver on. So shivering isn't so bad after all.
Apparently not.
So let's talk about infections.
Yeah.
Infections in the body, whether it be Lyme, whether it be viruses, etc., can lead to a problem. How about if you tell me what happens there?
Well, you know, I think people need to understand that certain infections can actually trigger an autoimmune problem. And when you look at a lot of various autoimmune diseases, and specifically like Hashimoto's disease, which is an autoimmune thyroid problem, something like ankylosing spondylitis, which is a problem with the spine, you know, across the board, we often find that there is an infectious agent that is really the source of triggering that inflammatory reaction. So, you know, on the surface level, you see these autoimmune problems and you think, well, okay, yeah, I've got this autoimmune issue, something in the immune system's not functioning well. And often the therapies are really designed just to suppress the immune system. Whereas if you start really looking at that underlying cause and see that there's an infection that's triggering the reaction and deal with the infection, you know, the need for those immune suppressive medications really starts to go away. So, you know, if we're really into root cause medicine and we're trying to get to the source of what's causing people's issues, you know, this is something I think that, you know, anyone that has any kind of autoimmune problem really should be evaluating, is there that underlying microbe that can be causing the problem? And again, when you look at the research, we'll see it's bacteria, it can be viruses, in some cases even parasites or fungi. So, you know, we have to, you know, put on our detective hats and dig deep and try and figure out what is it potentially that might be causing these problems. But when you go into the medical literature, I mean, if you go into, there's a thing called PubMed, it's the big national database of where we publish all of our studies. And you type in whatever condition and you put the word and molecular mimicry, you know, you'll find all this data come up about what we know are associated with these various conditions in terms of a microbial cause. So, you know, anybody can go on their own and look up this research, but I'm always surprised the number of, you know, doctors and healthcare providers that really don't spend the time to do this legwork for their patients.
You know, I had a group of primary care docs, one in particular that had some quite negative things to say about me to a patient. And I sat on it for a while. And then I sent a letter, and basically after I went through a litany of how dare you, I said, and if you'd like an opportunity to meet with me, that would be fine. And I would, you know, do that. So they invited me. Narrow-minded, closed off. We are like voodoo doctors. Don't you know that? We're like practicing voodoo. I'm like, it's not it's not what you think. Well, look at these type of tests you use. I'm like, yes, but if you've got a GI issue and you order an O&P for stool culturing as well, you're not going to get the information that I'm going to get. I'm going to show you it's not proven in research. I'm like, everything we do is science based. Well, nonetheless, the best part of the whole thing is they have heard about the microbiome. Ooh, the microbiome. So advanced, you guys. So I know they won't be listening to this. So I won't say names, but I can throw them under the bus all I want. But, the bottom line, and it really is unfortunate, is a lot of the primary care people are, when it has to do with insurance, they're allotted only a certain amount of money to take care of a patient. And if somebody on the outside is spending the insurance money, then they're getting less or they're having to pay back. So, we're really, it's tough. It's tough in the United States with this managed care, et cetera. But nonetheless, let's get on to mimicry, because I think people misunderstand when you hear that someone is suffering from an autoimmune illness. They think that the body has just completely turned on itself
Right.
and against itself, and this mimicry is completely different. Can you tell us more about that?
Yeah, it's a pretty simple concept. It's basically if you've got, let's say, a bacteria in your body, and sometimes it's things that are part of our normal flora. I mean, that's really the crazy thing about this. We always think it's something that doesn't belong in our bodies that we get exposed to that sets off that chain of events. In reality, most of the things that trigger these reactions are things that are actually part of us. We have this thing called immune tolerance. Your immune system is equipped to recognize what's part of you and what's not part of you. And when it sees something that's not part of you, it responds appropriately. But in the case of what we call molecular mimicry, there's something on the outer surface of, let's just say, a bacteria, for the sake of argument, that looks very similar and in some cases may actually be identical to something that's in our own tissue. And what they found in the research is that something as small as 3 amino acid residues, so really just 3 amino acids linked together. I mean, that's tiny, tiny amounts of stuff, can be enough to trigger that reaction. So, we're getting into really complex immunology, and I don't think we really fully understand the mechanisms by which we lose that tolerance to self. But nonetheless, this is part of what's happening. And so our immune system, in the effort to go after the microbe, basically accidentally starts attacking our own tissue because structurally it looks very similar to something that's on the microbe surfaces. So as your body starts making these antibodies to get rid of strep or Lyme or whatever else it is, it may start connecting with our joints or our brain or our muscles or whatever tissue happens to be the target. And because these molecular mimicry targets can affect any tissue, that really kind of explains why we see such a variety of manifestations of these various autoimmune conditions. It just happens to be a function of what tissue gets selected as part of that process. But kind of coming back to your statement that you're just talking about with doctors being very closed-minded, I think it's really interesting that if someone really spent about 10 minutes doing the research, they would see, again, there's just a plethora of research out there on this subject. I mean, this is not fringe medicine. It's not alternative medicine. If you talk to any immunologist, a PhD immunologist, they'll absolutely validate that, yeah, this is a common problem. We've got, literally thousands and thousands of articles on it. So there's nothing about this that's fringe. And I mean, I think maybe the best example is like rheumatic fever or rheumatic heart disease. This is an autoimmune reaction to strep. And every doctor in the world learns about this in medical school. They'll all absolutely say, yes, this is a real thing. Okay, well, that's just one microbe, one condition. It happens with a bunch of other microbes and other conditions. So again, it's not a stretch by the imagination at all. And yet it's a common problem that I think, again, it just happens to get overlooked a lot in medicine.
Yeah, so you might find that I'm just wondering, how often is it that someone presents with just not feeling well and tired, and mainstream medicine gets a TSH and it's 4.2 2 and they're told it's fine. And, the whole cascade of events. You're bopping around from one doctor to another,
Right.
when in fact that could be the initiation of something with an underlying problem.
Yeah, I think we get into this point in medicine. When do you feel that you need to intervene? And not everything that people experience you have to intervene. Sometimes the body has a wisdom, and it'll resolve on its own without having to give a supplement or a medication. But I see people that come to my practice, and I'm sure you see it as well, that they've been to several doctors and they've got this collection of symptoms. They've got lab values that validate that there's a problem, and yet the practitioner just still ignores it. I'm like, what more evidence do you need to start intervening when they've got the symptoms, they've got the lab evidence showing that that's what explains their symptoms, and yet you still don't want to step in and start correcting the problem? I think conventional medicine is probably best when there are very serious, life-threatening problems. This is where heroic medicine is truly life-saving and amazing. But when we start to see people drifting away from the norm and having these very subtle symptoms, or maybe just minor elevations or changes in their lab values, it's very easy for conventional medicine to sort of dismiss it. But I think this is where we step in and say, hey, look, you've got something going on here. It's early. Best time to intervene. If we can start correcting that problem now, we're going to potentially prevent a much bigger problem down the line. And I think with autoimmune disease, for unfortunately for most people, by the time it gets to be a problem, it's a problem. I mean, it's one of those things that we often don't necessarily see early on, those symptoms, or if the people have the symptoms, they often ignore them because they're not terrible, they're a nuisance, it doesn't drive them to the doctor to get evaluated. So often we're seeing people at those later stages. But for people who are early on, gosh, if you can intervene now, I mean, that potentially again saves people just a lifetime of problems.
Right. So if you're trying to intervene because something is at the level, let's go back to the thyroid,
Yeah.
it's not quite right. So you put on your Sherlock Holmes cat and cap, not the cat, the cap, and you're investigating and you do find an infection. Can you be sure that's the association, or do you take it one step at a time?
Yeah, I mean, I think that's where, I mean, let's take, thyroid, for example, Hashimoto's disease, which is a common thyroid autoimmune problem. We know that up to 80% of people who are hypothyroid, so have an underactive thyroid, is Hashimoto's. So most of those cases are autoimmune. And yet if you go to the endocrinologist and say, well, why do I have Hashimoto's? They kind of shrug their shoulders and go, I don't know, it's autoimmune and it's whatever. But again, if you go into the literature, we'll see that Epstein-Barr's been associated with Hashimoto's. Yersinia, which is a bacteria, is associated with Hashimoto's. H. pylori, a bacteria, is associated with Hashimoto's. Lyme disease is associated with Hashimoto's. So, if we've got laboratory testing that shows that there's been exposure, it is a little bit of kind of putting two and two together. Can I prove that that's what's causing the problem? No. But is it reasonable based on what we know from the research that this is a potential trigger for Hashimoto's, and if we deal with that trigger, the Hashimoto's may get better? It's just logical. So, we kind of take what we see in the research plus what we see in front of us, put the two together, and that gives us a pretty good indication that that may be part of that underlying cause.
So we're looking at antibodies for Hashimoto's, and if we come up with a virus, etc., and now we support the immune system, we help the body kind of put that virus to sleep for a while, do you see the levels of the antibodies dropping or drop?
They can, in some cases. So, in some cases, I've seen the antibodies drop off, and I've had some patients where it drops off just completely. They go completely back to normal. I've had other patients with their antibody levels drop, but clinically they feel a lot better. So, I mean, again, at the end of the day, we treat people, we don't treat labs. So the lab values can give us a clue sometimes that we're on the right track, but ultimately, I think we're interested in getting people feeling their best. But yeah, I think, with Hashimoto's in particular, because it's, looking at these, potential infectious triggers. I've also seen, things like food allergies related to Hashimoto's. So not every single autoimmune problem necessarily has an infectious trigger, but again, I think it's something that should at least be examined.
Wow, that's interesting in terms about the food. Are we talking about truly IgE allergies, not a sensitivity.
No, food sensitivities is really the better term. Fortunately, legitimate food allergies are pretty uncommon. And those people that have those issues have more of the typical, if they eat the wrong food, they get, swelling of their throat, itching, hives, things of that nature. Where with the type of things related to Hashimoto's tend to be more of what we call food sensitivities or food intolerances. So these are often delayed reactions to food that can occur hours to days after you've had exposure to it. So yeah, it's a little bit different than a run-of-the-mill food allergy.
Right, right. Elimination diets can be a good way to assess what's going on with someone if that's the case. Do you like
Absolutely.
do you like to do sensitivity testing on people, or do you try an elimination diet first?
Well, Alan Gaby was my nutrition teacher when I was a medical student. And if you don't know who Alan Gaby is, he's very well known in the nutrition world. And he wrote an enormous textbook for healthcare providers and studied, the medical literature on nutrition for the last 30 plus years. And, he was the one that taught me about elimination diets. And the great thing about elimination diets is that anybody can do it. It doesn't cost you anything, just a little bit of know-how on how to do the elimination reintroduction phase. But basically over the course of 3 weeks, you can kind of figure out what foods might be bothering you. So it's pretty straightforward. What I found in doing that with a lot of my patients, though, is that during the elimination phase, which foods do I need to really eliminate? Sometimes people were having reactions to not the major foods that we typically think of, like, wheat and dairy and soy and eggs and nuts and so forth. So it became a little bit more challenging if it was a minor food that was bothering them. And I found a lot of people, they just wanted to cut to the chase, which foods actually bother me. So in our clinic, we typically test people to find out very specifically on what bothers them. And it just saves them the time of having to figure it out on their own.
Right, right. That's true. I mean, because a lot of times people have seen so many, it's been so much time already that they want to feel better quicker.
Yeah, but I think it's good to know that, again, if you're in an area where you don't have a good, functional medicine practitioner and you just want to know for yourself, again, anybody can do this at home.
Right,
And there's a
right.
lot of resources online. If you don't know how to do an elimination diet, you can just type elimination diet into Google and you'll find a lot of resources on doing it yourself.
So there's a lot of information about familial tendencies. So especially when it comes to autoimmune, people will say, "Oh, well, my sister has rheumatoid arthritis, and so did my dad. So I'm just going to get it." And that is a factor. We don't know sometimes what is that big trigger, right?
Right.
Maybe there is a genetic component. We know that genes are only predictors, but there's got to be something else. How do you feel that genetics plays a part? What do you think that role is?
Well, we've got so much research coming out on what we call epigenetics, and it's really the expression of these genes based on environmental exposures. And when you see, different autoimmune conditions that pass down through families, is it truly genetic? Or is it just these families all grew up in the same area and had similar environmental exposures? And that can be very hard to discern unless you've got family members that truly grew up in different parts of the country, different parts of the world, and they still express the same kind of condition. Then you could probably say, yeah, it probably really is genetic. So I think it's a combination. They say if, genetics load the gun, the environment pulls the trigger. So I think that's true for most of these conditions, that, the genetic piece is a disposition. You're not necessarily destined to have these kind of autoimmune issues, but, we do tend to see this familial tendency. So I think it certainly disposes people. And if they have that disposition, plus the environmental exposure, that's where we start to see these different things manifest. So that's where, if we can get in early, really monitor diet, monitor environmental exposure. And that's why, we're really, so interested in educating people on, how to protect themselves early on from these different things. And unfortunately, we live in a more toxic world between our food and environmental exposures. I think it gets harder in most places in the world. But, even with the world being is what it is, it's still something that you can be proactive in and, minimize your exposure.
Right. So, your approach versus general medicine when it comes to identifying and treating something, let's say Hashimoto's, how would you go about it, uh, versus maybe an endocrinologist would, hold off until a TSH gets to above 10. What do you feel is the right way to approach that?
Well, with Hashimoto specifically, again, I think it's looking at those potential underlying triggers. And I don't think it's the same trigger for everybody who's got Hashimoto's. So, that's where we do a battery of, blood tests, looking at various infectious agents that we know are associated with Hashimoto's. I pretty much do stool testing on all my patients because sometimes we'll find that certain gut microbes are also associated with Hashimoto's. We'll typically do food sensitivity testing to make sure there's no food component. I think people need to understand that it's the total load on the body that's really the the big factor. We like to break it down into individual pieces, but in reality, it's the total exposure that potentially creates the problem. So any one exposure by itself may not be a big deal, but they start adding up over time. So it's a function of the length, the duration of the exposure, the degree of which the exposure occurred. All of these factors play a role. So as an environmental medicine doctor, we're always interested in looking at the total body exposure, and that's why we're looking at allergies, sensitivities, things we know that provoke the immune system, infections, things that can provoke the immune system, chemical exposure, toxic metal exposure, any things that can undermine the immune system, because all of that potentially is going to have a negative impact on how your body starts, again, holding immune tolerance or not holding tolerance. So it's just about really looking at the whole person.
When we look at herbal ways, food ways to support a thyroid gland, do you have any suggestions for that?
Well, from a food standpoint, I think, kind of going back to a basic anti-inflammatory diet is helpful for pretty much anybody, and that's really eating a mostly plant-based diet. Depending on who you read, there's some varying opinions on that. I really recommend following an alkaline diet, which is really eating a diet that what you eat breaks down into making your body more alkaline. We've got some research out there that this really helps promote tissue repair. It's an anti-inflammatory diet. It's good for your bones and several other health benefits, including cardiovascular benefits. So that's really, mostly plant-based diet and keeping your animal protein down to about 20-25%. There are certain foods, with Hashimoto's that they typically recommend, you avoid. They call these foods goitrogens because they can potentially exacerbate the problem. So that's some of these cruciferous vegetables. Um, in clinical practice, I have never seen anyone who actually had a negative effect from these foods. It's one of these things I think they teach you in school. I think the reality is the quantity of those foods you have to eat to really become a problem for your thyroid is probably pretty high. And I don't think I've seen anyone who eats so many of them that it's actually interfered with their thyroid function. So I am not actually terribly concerned. And because these foods are very nutrient dense, they actually, are actually very beneficial for your liver. I think that the benefits outweigh the risk, and I don't advise people to stop eating these foods based on that. And then in terms of, herbs and other supplements, I mean, we've got a lot of things to help support the thyroid. From a botanical standpoint, we've got herbs like, fucus, which is commonly used. I've actually not used a lot of herbs for Hashimoto's. Again, I just wasn't finding like huge benefits. It's something that's been used in botanical medicine for a long period of time. So again, I think if you catch people very early in their disease, herbs can be very beneficial. If they're later in their illness, they probably won't be as beneficial. They're certainly not harmful, but that's something that people can certainly explore with their practitioner if they're interested.
Right, right. I mean, cruciferous vegetables. That's like every polycystic ovarian syndrome woman is told eat lots of cruciferous vegetables. So
Yeah.
yeah. So mimicry. Back to mimicry. That's initiated in the gut. Yes.
Well, I think a lot of it can be. It doesn't necessarily have to be. I mean,
Okay.
molecular mimicry can happen anywhere. I mean, if you think about certain viruses, a lot of these viruses, they don't particularly live in the gut. Something like Epstein-Barr virus, can get into your lymph nodes, can get into your neurological tissue, as can a lot of other viruses. And they can trigger, we know with like multiple sclerosis that Epstein-Barr is a known trigger through molecular mimicry. And that's mostly, found in your nerves and your lymphatic tissue. So yeah, it doesn't necessarily have to come from the gut. But I think the gut is a source of a lot of it for for some people.
Right. So, stool testing can be really important. What are you looking for in the stool testing that could give you a clue of what's going on in someone's body? Especially if they're not really having any gut disorders.
Well, with the gut, it's always about balance. And I think with all the new DNA technology that's come out looking at our microbiome, again, I think our technology is ahead of our understanding. We've got, groups like, uBiome and Viome that do this very complex sequencing and tells you exactly what's in your gut, but we don't really know what it should look like. And how many people out there have never had an antibiotic, have really a pristine gut, have always eaten healthy, clean food that doesn't, somehow sway the mixture of the different microbes in your gut. So I think we're still in that process of understanding what a healthy microbiome should look like so that we have something really to compare it with. And right now we're just getting a bunch of data on individuals, and at some point we'll probably hit that threshold where we realize, yeah, this is really what a healthy microbiome should look like, and this is what it looks like when it deviates. So what I'm looking for specifically is their gross overgrowth of certain microbes. When we start to see overgrowth of Klebsiella and someone's got like a joint or muscle problem, well, we know that Klebsiella is a major trigger for that. That can be helpful. If we see massive overgrowth of yeast, well, yeast can be a trigger. So when we start to see things really getting away from the norm and really overgrowing, again, that can be a sign that it's a potential trigger. But again, I think we're always hard pressed to prove 100% that this is what's causing the problem. So we really are, using it just as a guide of, what has your exposure been? And if we see that your exposure has been higher than normal and you're having the symptoms, that gives us an idea that maybe that's what we need to target.
Do you see goiter in people who are presenting possibly with an underlying infection? I'm
Well,
thinking of this, and thinking that I see more often the lab work off without seeing something physically going on.
we'll see goiter certainly in some individuals, particularly if they're hypothyroid. It may or may not represent any kind of infectious process. I mean, I've seen it, in mostly women, with or without Hashimoto's disease. So again, you can get a goiter just by virtue of having an underactive thyroid. But I mean, that is a physical sign. When you start to hear, particularly with thyroid, about, an enlarged thyroid, if you hear about, hair falling out and constipation and dry skin and sleep problems and depression and constipation, I mean, all of these can be signs of an underactive thyroid. And those may be some of the early signs even before the TSH is really off. So again, if we start to see these signs, that may be an idea we want to start, monitoring closely. Take a look at other things like iron deficiency, which very closely mimics hypothyroidism. But again, it's just about getting to the root cause.
Right, right. And, long time ago, everybody would have Morton salt. Yeah, and
Yeah.
when it rains, it pours, because that's what the little caption was on there. And that was fortified with some iodine.
Yeah.
And now a lot of people have moved over to other types of salt because they're a little bit denser in minerals. But again, there isn't the iodine component in it. And so that's important, between that balance of iodine and selenium. Do you see that a lot, that
Yeah.
imbalance? Yeah.
Well, particularly in my vegetarians and vegans, they're the ones that are most at risk because, iodine is found in animal sources. It's in meat, it's in eggs. So unless, you're eating a lot of seaweed and other high iodine vegetarian foods, it's very easy to become iodine deficient. And same thing with the iron. Iron is a cofactor that helps your body convert T4 to T3, and T3 is the hormone your body actually uses. So if you're not eating iron-rich foods, and heme iron, which is found in red meat, is just a higher source of iron that's found in vegetarian sources. So it's not that you can't get iron through vegetarian sources. It's just that the amount of food you have to eat is much larger. And a lot of my vegetarians consume a lot of soy protein. And we know that soy is one of the things that actually blocks the absorption of iron. So I think, my vegetarians and vegans just have to be very mindful of, their iron levels, their B12 levels, iodine levels. They're just harder to get in vegetarian sources. And so you just have to make sure you're covering the bases.
How do you feel about general labs screening for these minerals and certain components? Because, we even know magnesium has to be done within the red blood cell. What about some of these other minerals? Do you find that that's sensitive enough and accurate?
Well, your body has a built-in mechanism that it controls a lot of the minerals in your body. And even as you start to become tissue deficient, your blood levels may look normal. So by the time your blood levels change, your tissue levels have already probably been depleted for a while. So yeah, if you're going to do any type of nutritional analysis, typically we'll do something that more closely represents a tissue sample. And short of doing tissue biopsies, which pretty much nobody does, we'll use labs like SpectraCell or one of those groups that actually looks at, red blood cells or sometimes white blood cell minerals and vitamins. They'll give you at least a better approximation of what's in tissue.
Yeah, and this is one of the things that I've had issues with when I have someone who I've found through a SpectraCell to be B12 deficient, and they go to their primary care, and the primary care, you're smiling, I can see you smiling. The primary care goes ahead and says, well, I don't know this test, so I'm going to draw a standard B12, and that B12 is normal. The patient then loses, confidence that I know what I'm saying, and it can be very, very difficult. But it's important for people to think again and listen and actually do their own investigating and be an advocate for themselves.
Well,
Because
absolutely. And, I think people need to understand with lab values, because I think this is a big source of confusion for people. When you look at a reference range, understand every lab has to establish their own reference range. That's actually a guideline from CLIA. So, I used to be a medical technologist. I worked in the lab in Chicago. I did all this work, and you would literally grab 100 people off the street and go, "Are you normal?" You say, "Yes." "Okay, can I draw your blood?" And actually we used to use each other as controls because we just figured we're all normal. What if you're not normal? So all that lab value is representing is 95% of the people who got tested. That's the range in which they fell. It doesn't tell you anything about what's optimal or what's ideal, and which is why if you go from lab to lab, you'll see the reference range changes a little bit because it's just reflecting that one specific lab, which if you think about it, doesn't really make a lot of biological sense. As far as I know, we're all human. So why your labs would drastically change between Detroit versus New York, if you are, a male or female of the similar age, I'm like, yes, we can have gender differences and yes, we can have age differences. But aside from that, why do we have such a wide variety in these values? And I think of something like ferritin, which is an iron marker. Well, the normal range they show goes down to 10. Yet if you look at all the literature, they find that when you drop below 50, you start getting signs of iron deficiency. So an optimal level is above 50. So we've never adjusted our values to what's optimal. It's always been adjusted to what's out there. And I think because so many people are not healthy, our pool of what we used to think was healthy has really changed, and therefore these reference ranges keep changing to reflect that, making more people look normal when they're not normal. And so that's where, again, if you're working with a good functional medicine practitioner who understands kind of how to read between the lines, we can start to see the trend on where your thyroid's at, where your iron levels are at, or any other analyte that you're looking at. But just understand that what's on that piece of paper is certainly not representing what's optimal.
it's a snapshot
At best.
at best. But yeah, you have to go by clinically how that person is feeling. So what are your pillars for your care? What I'm asking basically is on the grounds of diet as well as lifestyle, etc. What are your pillars that you really base your practice on?
Well, I think, my population of people being mostly people with Lyme disease and children with autism, and although they might sound quite different, fundamentally they're extremely similar. And, it's really about diet and gut health. I think, diet, gut health, detox, that's where it all starts, because you can correct so many of these underlying issues by just dealing with that piece first, and then we can start to layer in other therapies as needed. But if your gut's not functioning well, that means you're not necessarily digesting and absorbing your food the way you should, which your body needs to sustain all other mechanisms. Up to 80% of your immune function comes from the gut. So if the gut's not functioning well, your immune system may not function well. So making sure that your gut in good working order is important. Diet, of course, is tied into the gut. What you put in your mouth obviously affects the gut, but it's also about, really being mindful about treating food as medicine and not just something I need to get through the day. For people who live on processed, junk foods that aren't nutrient dense, you're just more disposed to start having different kinds of health issues versus someone who eats a plant-based whole foods diet, that's mostly organic and, clean, healthy food. So again, this is something that anybody can do. You don't have to be a doctor to figure out most of this stuff, but it's really just the commitment of, starting with that part of your health, because if you can get that piece under control, it's going to be easier with any other therapy you do out there, whether it's a supplement or even a medication. It's more likely to be more effective when you've got these foundational pieces working well for you.
I think sleep is huge, but
Sleep is huge. Yeah, absolutely.
it's a problem. It's truly a problem. I think, well, I'm going to say it's more of a problem with women, especially when they get past 40, 45, and there's some
Yeah.
huge fluctuations in hormones. And, generally sleep hygiene, we talk a lot about that and how you really need to protect yourself by shutting off the phones and the computer a couple hours before. You really
Yeah.
need to try to go to bed around the same time, get up around the same time. There are certain things we can use like GABA and certain passion flower and L-theanine and things like that. But what do you do when you get to the point where nothing seems to work for these people?
Yeah, I mean, sleep can be very complicated. And again, it's one of these issues where I think it varies so much from person to person of why they don't sleep well, whether their issue is falling asleep, staying asleep, or both. I mean, I've had some people who just take everything under the sun and they just have a hard time getting their body to get out of that fight or flight state. And yeah, it's complicated. I think it varies so much individually. I'd hate to say, well, you just need to do this, because there is no one thing that works for everybody. For some people, it's a function of disconnecting from their electronics a couple hours before bedtime. For other people, some of the herbs and supplements we use do the job. For other people, it's really learning better stress management techniques, because their brain just doesn't turn off when they go to bed. For other people, we've done things like PEMF, where that seems to help get them into a more relaxed state. I've had people do acupuncture. I've had people do neurofeedback. I've had people do hyperbaric oxygen. So, you just kind of have to find what works with each person. Look, I have some people who use medication, and as much as I try and steer clear of it, I've had some people where that has been the only thing, at least up to that point, that has really gotten them to at least get some sleep. And for people who don't sleep at all, even not getting great sleep is better than no sleep. But ultimately, sleep is a pattern, it's a rhythm, and we have to get the body back on that rhythm. And I think where the worst cases I've seen with people is that somewhere along the line, something really disrupted that rhythm. And so it's just takes a long time, some cases, to really get their body back in sync, because there's all the hormones that are involved with sleep, and you've got to get your body retrained to get those hormones working the way they're supposed to. So yeah, it can be really complicated. And my thought is always that keep trying different things. Find the thing that works best for you. If it worked great for someone and didn't work for you, it doesn't mean it doesn't work for everybody. It just didn't work for you, and then you move on to the next thing. But your brain literally flushes itself out when you sleep. That's when it does all its detox. That's when most of your tissue repair happens. So outside of diet and gut health, yeah, sleep would definitely be at the top of my list of things that are absolutely necessary to heal.
You weren't primed for that question, but you did it perfectly. And I was waiting and I was hoping you were going to say exactly what you said. Just because it didn't work for you doesn't mean that there is not something else that will work for you. And you really need to continue on that path. I have a few patients right now that Well, that are having either learning issues or they have been diagnosed autistic. And wow, those families, talk about the patience. So you've got this little one or this young teenager, and that's the patient. But do you find that you have to help the family as well?
Well, absolutely. I mean, it's a family dynamic issue, even though it may be the child itself that's they're the ones that are affected physically, but the dynamic and how it affects the whole family, because there's so much care and therapy that's involved with these kids, that it's, managing their diet, it's getting them to speech therapy, occupational therapy, physical therapy, ABA. There's a whole schedule, and a lot of these kids are very rigid and routine oriented. So yeah, it is probably the ultimate test of patience as a parent, when you've got a special needs child, just to have to schedule and deal with all the things you have to deal to help your child get well. Um, it's 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 probably not a lot different than what happens with a lot of my Lyme patients, though. It's the same thing, where it's about schedule and routine and strict diet and taking supplements and being routine oriented, just to get your body in a rhythm. uh, they're different, but in so many ways they're very similar. And I think, again, the fundamental things of gut health, diet, it's still the same.
Right, right. And we do talk a lot about pooping in my practice. How about you?
Yeah, I think it comes up pretty much with everybody, and not everyone's favorite topic. Yeah, what color, how big, how often. I have more pictures of poop sent to me than I can shake a stick at. But
Wow.
again, I was
Wow.
a microbiologist for many years before I went back to medical school. I've looked at a lot of poop. And so people think, they've got these parasites coming out of them, and they'll get pictures and I'll look at it. I'm like, no, that's not a parasite. That's just a string of mucus and you're fine. So,
Wow.
but yeah, I
Well,
do get a lot of pictures of poop.
wow, you're the kind of doctor people want to go to, because really, if you can be that close to your patients, yeah, I want to party with you, cowboy. That's excellent. That's excellent. Do you have any other thoughts surrounding autoimmune illness?
Well, I think, for someone who already has a diagnosis, it's never too late to intervene. We'll start making these diet and lifestyle changes. I mean, I've seen some people that have had some amazing recoveries when they made that commitment to really focus on their health. And again, it's mind, body, spirit. It's so easy to throw pills at you and deal with some of the physical things, but there's a huge, huge mental, emotional component, I think, to any autoimmune illness. And that's certainly not to say that, it's all psychological, because it's not. But being chronically ill does have a toll on your mental health and your relationships. So it's important that, we're dealing with the whole person, and that we're making sure we're taking care of the brain and the mental and the psyche as much as we're dealing with the physical symptoms. So it's really, again, whole person approach. And don't ignore the effect of stress on your body. I mean, I have seen it just make people 1,000 times worse. And teaching people how to master their stress. I have a colleague, Heidi Hanna, out of San Diego, who's got some great courses on helping you. I love it. She says, you don't manage stress, you master stress. I'm like, I love that. That's exactly what we need to do. It's not just about getting by. It's about learning how to let that stress not bother you in the way that it does, and to have that impact on your body.
Oh, I thank you, because that is really good. I'm also excited to tell my listeners that my daughter Kara and I have put together, it's almost completed, a quick start program for autoimmune illnesses, learning about them, what it's caused from, and some ways to treat it, as well as a whole program for food to help you out with that. So that's going to be available through Health Means, probably spring of 2020. And we actually had a quick interview with Dr. Tom O'Brien. He's like the big guru with
Yep.
autoimmune issues. He talked quite a bit, and so I've got to find that one segment that's going to be worthwhile. He is funny. Fire in the hole. That's his big terminology. I get a chuckle out of that one. So, well, this has been very, very enlightening. I think that a lot of people are probably out there. They know someone. I think it's just about everything in the world. You know somebody with Lyme. You know someone with cancer. You know someone with an autoimmune illness. And I think a lot of people don't pay enough attention to themselves. You know, they're out there and they're just mindlessly going from one place to another, and they need to stop. They need to stop, take a big deep breath, and be present, and just really take care of themselves. Because, you know, I mean, we're not getting any younger. You know, we're all on that treadmill going forward, and everybody thinks like that you and I were like the greatest patients and we do everything that we tell everybody to do. And I don't think we do that all the time, you know, but we have to try, right?
It's the best we can do.
That's all we can hope for. Well, everybody who's been listening, this is yet another episode of Living with Lyme. Come back and see us soon. We're excited to bring you this. This has been Cindy Kennedy and Dr. Darin Ingels, and we look forward to talking to you soon. Take care, everybody. Bye.